U of L Health tonight says the test that was used across the nation to see how well your kidney is functioning has been negatively impacting African American patients for years. According to U of L Health, African Americans are at a higher risk to develop kidney disease. They're approximately 4 times as likely to develop kidney failure. They say by far the best treatment for kidney disease is a transplant. It adds 7 years to a recipient's life on average, they say, but a major problem was for years African Americans were not getting put on kidney transplant lists when they should have been. To calculate how well the kidney is functioning, doctors would use an equation to calculate a GFR. The factors would be age, sex, the amount of creatinine in your blood, and for a long time, your race.
The reason why this coefficient was added for African American people is that the assumption was made that African Americans have higher muscle mass. Well, the problem is that there's no good evidence that African American people actually have higher muscle mass. This was based on really poorly conducted 3 little studies, and it just was assumed that they have a higher muscle mass, and nobody ever looked until now if that's really the truth.
Well, the coefficient in that equation falsely projected higher functioning kidneys for African American patients, and it would take them longer to get put on kidney transplant lists because of it. Now U of L Health says they are sending out letters to have all of their patients who have undergone this test, and they say they are going through their entire transplant list to find patients who have been falsely listed later than they should have been to correct the mistake.